Hi there. I just got back from Chicago and got to participate in the American Sociological Association's 120th annual meeting this year in Chicago. And I got to present as part of the Sociology and Practice Settings Symposium. My research was on reconnecting the pieces, building social capital to address fragmented social systems. So I'm going to go ahead and go through the slides and presentation here and just kind of share this for a bit going forward. To ground this conversation, I'd like us to begin by walking through a moment in someone's life, similar to many we encounter in health services and community work. Let's imagine the daily reality of someone facing both housing instability and food scarcity while searching for work, and they currently have no phone to stay connected with care. They're completing regular check ins with probation after a recent arrest, and they were given a new bipolar diagnosis due to that incident, and they began taking medication for symptoms. Now imagine the mental health clinic doesn't communicate with the local housing agency. The probation officer isn't on file in either system, so the court and property officials both have no idea their client's meds were cut off last week after a missed appointment. When this person misses next month's meetings, all separate institutions call an old phone number on file that's out of service. Who carries the weight of that disconnection? It's the person in crisis, now tasked with managing this puzzle while simply trying to survive. If we have our client here, we'll call them Alex, someone in need of social services. There are going to be several systems unique to their scenario that they must learn to navigate on top of the ones we're all too familiar with, like the IRS and banks, utility companies, and so on. Research shows that families experiencing poverty regularly interact with between 2 and 14 different institutions at once, with an average of 8. And each is designed as a separate entity. They have different funding streams, languages, and often different values, each with its own portal, rules, and expectations. But Alex isn't managing one system at a time. Their needs likely span across multiple institutions, and because of the one sided nature of outreach and communication here, their result is a maze. A never ending stream of appointments, phone calls, and resubmitting paperwork, each demanding time and emotional energy. Overlapping deadlines, eligibility lists, and wait times so long that the cycle repeats itself. These are just a fraction of the hidden burdens families carry every day. And these institutions are layered, of course. The courts touch everything from managing a juvenile case to cyclical incarceration. Schools bring their own processes, all healthcare services, including mental health and substance use treatment, funneled through federal or state programs. As sociologists, we often study or work within these systems individually, but people don't experience them that way. Without coordination or support, navigating this maze isn't just inefficient, it's harmful. When these groups fail to connect, we create a loose net that often allows the person in need to fall through entirely. That's not a fault of individuals, that's a structural failure. We saw that Alex is connected to several systems, but those agencies aren't talking to each other. And yet they require information and documentation from one another because they exist to serve the same communities. But every request, every referral, each new department becomes another task for Alex to manage, sending them back and forth, completing steps and forms from one to give to another. We see daily in practice that these systems designed to support people are often the ones making it hardest to survive because they're not communicating. Programs and policies throughout this net often treat Alex like a blank slate at each touch point, ignoring their history and any context behind the different streams they're managing. This confusing outreach mirrors the data we see as well, and if we add those original obligations back in, that this is unmanageable. And it's not just about isolated service gaps. In our discipline, we know that poverty governance as a whole often reinforces the inequity it should be addressing. That web is even more disorienting because many of the people caught in it were never taught the foundational skills that would help them navigate it in the first place. Things like financial literacy, administrative prep, or understanding credit or insurance coverages. From managing medical care to legal cases on your own, the learning curve here is steep. Alex is expected to comply with, remember, an average of 8 systems with no prior guidance. We know that race, class, and stigma shape every step of this experience, and these gaps in real life training only add to those conditions. And the data supports this as well. A 2022 study by the UN showed only 40% of US citizen users have confidence in the government organizations they interact with. partially because they score over 30% lower in usability and efficiency than private sector practices, which many of these folks may not have access to. How can we stop perpetuating the cycle when no one teaches you how to do better? Some of our daily roles may give us access to some of these missing links. We're experts in communication, and yet our role in the applied world is often misunderstood. We know why institutions fail certain groups because we understand the patterns and power dynamics through frameworks like social capital, those vital connections between and across communities that build and maintain trust. Many of us are already working within these systems, so we have direct influence on someone's cultural capital, where who and what they know about how our society operates can promote upward mobility for them. Our practice gives us language for things that others overlook. The power comes when we use it with intention. In practice, I use our principles in ways like having plans in place for when a patient is treated differently because of their circumstances. I advocate for unified care to strengthen what they're already working with, and more on network mapping in just a second. I'm focused on building their social assets so they're more prepared moving forward. When we apply this to our work, trust begins to travel through the system, and that connection yields huge returns. We see improved health outcomes, more resilient families, and much else over time. So, how can we meet Alex where they are today to help connect some of these dots? One key might be that someone just has to map the system. A person's social condition is their survival strategy, and larger programs are slow to change. So much of the support we offer in community work is informal but life-saving and cross-cutting. A county caseworker often helps a family both avoid eviction and maintain job stability. A youth who feels safe in a community space is more likely to return to school if that's an issue. That's where our more informal ways of adding to someone's social capital might step in. Whether you're in service, research, or policy, you can ask, where is trust being built and where is it being broken? What relationships need to exist that don't yet? Someone has to be able to hold the complexity and foster these connections, and this is where we can start. This is capital building in action, not just more services, but smarter, connected networks of care. If we know that social ties shape outcomes, these person-centered moments are our entry points. We can start to bridge these gaps right where we are by creating a quick network map for a client or student and list every institution they're expected to interact with. Use it as a team or program activity to pinpoint the disconnections. What hurdles are built into this person's maze? We can advocate for trainings that explicitly include systems navigation, making sure our clients understand how they operate and know what to expect. In network, connect with one other department or group you already interact with and propose a single resource for mutual use, maybe a shared intake form or a collaborative referral chart. The more examples we collect, the better, of issues caused by this maze. Families being denied services due to paperwork loops. Agencies losing track of a client altogether, like in our opening example. Use that data in internal reviews or take it to a local board meeting, share a public comment on it. We can spread that effort by showing up to those meetings and introducing contacts or sharing resources across organizations. By building intentional points of connection, we start to shift the burden from the individual to the network, building a stronger foundation for even broader change. More formal capital building in that larger context might look like those relationships we created expanding, allowing systems to collaborate more rather than compete. Maybe that shared access between agencies is used to help align future policies or workflows. If the informal approach is your practitioner helping you navigate a system, formal growth might look like them being restructured in a way that actually coordinates. If the vision is systems that simply talk to each other, maybe it looks like new digital infrastructure, a sort of social systems map. One integrated hub to visualize and reinforce the support networks individuals rely on across institutions. Maybe we build tools for trusted providers that only operate with the client's consent in a station that shows their whole landscape, so we're not always rebuilding trust from scratch. As we work to solve today's problems with today's tools, we also need to imagine what tomorrow's tools might look like to meet the challenges of the future. Our social services and the communities that rely on them are in a particularly fragile place right now. And at the same time, we're quickly entering a digital renaissance of sorts, where we're seeing technology rapidly reshape entire structures of work, power, and access. Broken connections at the system level affect public health in many ways, and it's really not a question of if we can afford to integrate systems. We can no longer afford not to. Major social advancements rewire our communities, and the risks of leaving our most vulnerable behind are too real to ignore. As our foundation evolves, we have a responsibility and a huge opportunity to be essential architects of what the future structures of human-centered care look like for decades to come. The rest of Ms. Kaba's quote here asks us to think beyond what we have now and how we can make it better, but instead let's ask, what can we imagine for ourselves and the world? If we do that, then boundless possibilities await us. As I'm reimagining the future of work in practice, I keep wondering, what if sociology helped build the next public utility? Our practice gives us the power to create something better than what we currently have, and we can make a huge impact on meeting the needs of people that may need a lot of varied help in their present circumstances. If this resonates, I'd love to connect around any similar work. Here's how to reach me. Thank you so much.